In our continuing conversations on the various dimensions of the corona pandemic, I wanted to probe with you for just a moment for you to think about how incredible this response has been in 60 days, really, to this pandemic, and how almost univocal has been the message that is coming out. What is the precedent to that? What happened before this? And I'm talking years before. We have noticed over the last decades an increasing amount of centralized planning with regard, not just with regard to the economy, but also with regard to various industries, including healthcare. So that there have been these growing bodies of expertise on national levels and international levels with regard to healthcare, concomitantly almost with political centralization. And now it seems to me that these two spheres have bumped into each other, and that 60 days ago or so, the response to this has been univocal. Now, on the one hand, you want to say, well, if this is an international health crisis where there's contagion at risk, you want to have a unified response. Absolutely. My question is whether it is the government that is the best responder to this. And here's my concern. It is that when you have this political force united with healthcare concerns and scientific concerns, and that the scientific and healthcare concerns are being funded by the political concerns, that you have this one voice, one perspective, one agreed upon approach to a problem, so much so that any dissenting viewpoints or varying perspectives can be marginalized and indeed made illegal in certain context. We've seen this in the popular media where people just asking questions or reflecting on their own medical experience have been banned from various platforms, and this ought to concern all of us. We need to hear a variety of voices. This is why I've emphasized over and over again the principle of subsidiarity in this context, that various levels of society, precisely because of their intimate knowledge at those various levels, can contribute to a more holistic approach to the crisis that we're facing. I trust that this is something for you to think about and talk about with your friends and families, in your churches, and in various institutions. Let us know what you think. Thank you for watching, and know of our prayers and well wishes for you and your safety.